The Baylor Charles A. Sammons Cancer Center in Dallas, Texas provides personalized, comprehensive, and compassionate care for patients with all types of cancer. The Cancer Center is part of the Baylor Scott and White Health System, which is the largest not-for-profit healthcare system in the state of Texas. Baylor Scott and White includes 49 hospitals with over 5,800 physicians and 35,000 employees. For an inside look into the Cancer Center, Enclave interviewed Dr. Alan Miller, the chief of oncology at Baylor.
The way things are structured here within the Baylor healthcare system, or now Baylor Scott and White, is that we're all about providing patients with the best possible care they can get. Now, that best possible care includes the amenities that they experience when they're here. It includes the very skilled and knowledgeable physicians, nurses, and other healthcare professionals that they come across. But as a very important part of that, we build research and education into the care that we offer to every patient.
This access to care and other services improves the convenience of care. Angelia Drake, the director of clinical oncology research at the Baylor healthcare system and a cancer survivor who was treated at the center, describes the convenience provided to patients treated at the Baylor Cancer Center.
They have a lot of experts here, experts in the field of oncology, whether it's medical oncology, radiation oncology, surgical oncology. They have nurses who have been working in oncology for a long time. So they know that this place has the ability to give the best care that any patient could receive. Everything is within the cancer center here, so it's very easy for a patient to go see their physician, and then they're an elevator away from getting their labs drawn. They're an elevator away from going and getting their infusion. So I think the convenience factor really helps the patient because they're not feeling well, and you don't want them having to walk across an entire campus just to get where they need to go to get their treatments.
Part of providing the best possible care involves access to multiple specialists and clinical trials in a single location. This is particularly clear in the treatment of gastrointestinal cancers. In an interview with Enclave, Dr. James Fleshman provided more information on the importance of multidisciplinary care.
The unique aspect of the multidisciplinary team system at Baylor University Medical Center is that each one of the specialties represented in the multidisciplinary team gets to weigh in on the treatment of the patient up front without having to be having the patient seen in each of the individual offices. We have a real-time discussion, we have a evidence-based discussion, and we have a multimodality capability approach when it comes to managing the most difficult patients. So there's very few patients that we see that we don't have something to offer to them.
The Baylor Sammons Cancer Center at Dallas contains an extensive research program with a massive 450,000 square foot facility. Last year alone, this research program enrolled over 800 participants in over 15 disease-specific programs, making the center one of the most comprehensive in the country. Several aspects make these programs unique, Dr. Miller explained.
The clinical care and the research, I mean, nothing happens without them. But for people to be able to avail themselves of those things, we have to make it as easy as possible for them. So we have things here that I know a lot of other high-quality centers are doing, but I think we're doing them very well. Patient navigation is an incredibly important function. We provide patient navigators to every and any patient who wants or needs their services. Here, all of our patient navigators are nurses. Several of them are oncology nurses. Several of them have been oncology patients. They help, and I love the word navigate, because they help navigate the very difficult waters of going through complex cancer treatment. You've got appointments with 3 different physicians. You've got a scan over here. You've got another test over there. And the patient who's already overwhelmed by the fact that they have cancer can have a very difficult time being able to get all of that in order. And they find that they're sitting in a doctor's waiting room when they know they have to be somewhere else for a scan. The navigators help get all of that coordinated and take that burden off of the patient.
In addition to leading experts in research, Baylor houses several unique integrative medicine programs. These programs combine complementary, holistic, ancillary, and traditional medical approaches.
We have an integrative medicine program. People want to know about what can I do to help in my cancer care by nutrition, exercise, and other things. Our integrative medicine team helps with that. What can others do to prevent getting cancer? Again, that comes in there. And then the integrative medicine team can also provide certain support to the cancer treatment, including acupuncture for cancer pain and cancer nausea and some of the other things. We've got an exercise program for cancer patients. We've got a facility down on the second floor here. It's gorgeous and is open and available to cancer patients before, during, and after treatment. We've even got some studies going on with exercise that goes on during treatment. We have a nutrition kitchen where we have classes a couple of times a month that teach healthy preparation of food. Some for special circumstances, like patients who have difficulty swallowing and things like that. Others for just the general healthy approach to eating. So when you come here, you don't just get hooked up to a chemotherapy line, get your chemotherapy, your prescriptions, and sent home. The whole you is looked at, the whole you is treated. And not just you, but your family and everyone else who may be affected and impacted by your cancer. And it's putting all of those things together that really makes this a special place.